Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. I'm Lindsay Smith Rogers, producer of Public Health on Call. Since March 3rd, 2020, Public Health on Call has brought you more than 400 episodes with evidence and experts to help unpack the day's COVID-19 and public health news and what it means for tomorrow. As we wind down Season 4, we have a few thank yous. First, a big thank you to our interns, Kelly Corcoran, Caroline Wang, Alyssa Tsu, and Hannah Bennett, who bring fresh ideas and much needed support for the podcast. We'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast more than 6 million times. We're taking a break starting December 23rd, and we'll be back on January 3rd with Season 5 of Public Health on Call. We'll continue to cover the latest on COVID vaccines, treatment breakthroughs, and research. We'll talk about living with COVID and what our world might look like going forward as we move from pandemic crisis to endemic virus. We'll also cover other urgent public health issues, including racism, gun violence, mental health, climate change, and overdose. We so appreciate all the great ideas that come from our listeners, so please keep writing us at publichealthquestion@jhu.edu. And thank you for being part of this podcast. Today, Dr. Sharfstein speaks with Dr. Anand Parekh, the Chief Medical Advisor to the Bipartisan Policy Center in Washington, D.C. Dr. Parekh has led a project called Public Health Forward to envision a stronger and more robust public health system in the United States. Let's listen.
Dr. Parekh, thank you so much for joining us on Public Health on Call to talk about Public Health Forward, which is this report by a bipartisan group of state and local leaders about the future of the public health system. Tell us why now? We're still in the pandemic. Why do a report about the future now?
Thank you, Dr. Sharfstein, for having me on this podcast. I think this is a pretty obviously seminal moment in our nation's history, and certainly for public health while we're experiencing a once-in-a-generation event like this pandemic. And public health has been, as we know, on the front lines of the pandemic. And we felt the time was really now to ensure that the American public and policymakers appreciate the role of public health, not only during this pandemic, but even with respect to other health challenges that our nation faces.
And so you want people to start thinking about improving a system that in some cases didn't do everything we were hoping for during the pandemic.
That's exactly right. Public health has been in the spotlight, and Congress, to their credit, has infused short-term resources to support the efforts of public health to combat COVID-19. This isn't necessarily the long-term sustainable financing or funding that public health needs, but this is a time of opportunity for public health. Given that we have COVID-19 right now, given that we have some resources. But we also felt that this was a time of challenge for public health. And I think we're seeing across the country, whether it's public health officials being stripped of authorities or fired, we've seen the politicization of public health as well. I think we felt that now was the time, even though we're in the midst of the pandemic, to ensure that people understand that, public health can't be politicized. And at the end of the day, public health is not just public health's responsibility. It's all of our responsibility.
So on this point of politicization, you work at the Bipartisan Policy Center. Some people may be amazed that there's anything with the name of bipartisan in Washington these days. Tell us about the process that you used to put this report together, and was it in fact bipartisan?
Thank you for that question. So the Bipartisan Policy Center is a rather young organization, about 14 years old, founded by 4 Senate Majority Leaders, 2 Democrats, 2 Republicans. And really the goal is to promote health security and opportunity by bringing both sides, all sides together. And you're right, it's somewhat of a archaic concept. I think we're the only entity in DC with the word bipartisan still in its title. But that's what we strive to do. And the leadership of this effort came from a bipartisan task force. So these are elected and former federal, state, as well as local elected officials, as well as representatives of a variety of sectors important to public health, like business, like faith, like healthcare. And so that really was the group that ultimately helped to shape the report and sign off on the recommendations. So that bipartisan lens was important. I think the other important lens was that we didn't want this to be sort of a top-down report or something that comes from Washington, D.C. And thus the methodology was quite robust. We held over the summer 6 different roundtables with experts from across the country in a variety of key areas that the report focuses on, where public health needs to really focus on. We held focus groups. We held in partnership with the Bloomberg School of Public Health at Johns Hopkins. We launched a variety of surveys to get thoughts of frontline public health workers. We had a national public health advisory group. So we really tried to collect information from all corners to ensure that this wasn't top down, but really bottom up. And it really reflected, since that's the audience here for this report, state and local elected officials and public health officials. That's the audience. We wanted to make sure it reflects their sentiments.
Well, I appreciated the chance to share some thoughts with you during that process. And I wonder whether you think that extensive process was helpful in avoiding kind of political disputes over the content. Was that a strategy in a way to get past some of the politics?
I think so. And I think that's why we start with the bipartisan lens, which we think is critical, involving as many people as we can to garner consensus. And when we release, and we are in the process of releasing this report, we hope that will help to ensure that as many people are on board and they see this as not through the lens of one party or one ideology, but something that can be utilized by really all geographic areas. So I think that it does help. We've seen that at the Bipartisan Policy Center. We've seen that approach work in other areas. And so we hope that it's embraced by both sides of the aisle and at all levels, local, state, and federal.
All right, so let's open this report up. What do we find? What are the bipartisan conclusions for the future of public health?
Yeah, so this is a 5-year vision. So sort of picture 2026, 5-year vision for governmental public health in this country, really focused at the local and state level. And that's not to say that the role of the federal government is not important. It's not to say that the role of the private sector is not important to sort of complement those activities, but that is essentially the lens. And the vision, as one could imagine, really focuses on what a healthier America would look like 5 years from now, that we need to make advances in health equity through partnerships with various sectors and community engagement. We need sufficient and predictable and flexible public health funding. We need a modern, interoperable, secure information technology system for public health. We need modern laws and policies and statutes to protect and promote health. And then we need a workforce that's highly skilled, trained and diverse to ensure that evidence-based programs and services are implemented. So I think that first, the task force felt strongly that vision needed to be there. And then the recommendations are really organized around 6 areas. We call this sort of a framework for a 21st century public health system. You need to deal with financing, need to deal with data and information technology, need to deal with workforce, partnerships, community engagement, and laws and governance. And so then what the task force did was taking those 6 areas and taking all the information coming in from a variety of different sources, we identified 2 actions, essentially 2 overarching actions for elected officials and for public health officials at the state and local level. 2 actions in each of those six areas. And of course, the actions are somewhat different for an elected official versus a public health official in terms of what they can do. So I can give you a couple of examples if that would be helpful. For example, in the finance area, a critical action is utilizing existing funds to provide flexible funding to support public health services and capabilities. So what could an elected official do? Well, an elected official, governor, for example, or a mayor or a state legislator could ask that a detailed assessment be done of current spending levels in public health compared to what we know is necessary to ensure foundational public health services are provided. And then to see whether there are public and private sources through blending of funding or braiding of funding to really meet that gap. What could public health officials do? They could do an assessment of what they need, where they are, get a better understanding of their geographic areas to see maybe whether shared services could be one modality to help with financing and ensure that services are provided. And so again, that's one example of how the task force went through each of these areas and tried to identify, all right, what's something an elected official could do? What's something a public health official could do? Because then the premise of the report was you needed recommendations for both. Public health can't do it on its own. An elected official can't do it on its own. But it's really both of them together.
So talk a little bit about the headwinds facing a report like this, and then about the tailwinds, what can really make this successful. This is a moment where you may have had a bipartisan support for a report like this, but there are certainly people out there who are not waving the flag for a strong public health system. In fact, there are laws being passed in different states that are stripping the public health department of authority and resources. How do you think this report will fare in the political climate that we're in more broadly?
I think the framing of this report is very important. You're absolutely right. I think that there are some who view public health right now as simply the entity that's pushing forward mandates of all sorts, for example. And as you said, maybe half the states are now considering measures to limit public health authorities. At least 10 states have passed laws. But that's all using the lens of what has happened during COVID and mandates. And I think this is sort of a teachable moment for public health in terms of informing policymakers and the public that, look, public health is really all of our responsibilities. Public health is trying to assure people are in the best position to reach their own life goals. Public health is not just about vaccine mandates or mask mandates. Public health is about not just dealing with COVID. It's about dealing with the opioid epidemic and mental health. It's about dealing with diabetes and obesity. It's about dealing with clean air and clean water. And how you affect change in all of those areas requires not just science and evidence, but trust and meeting people where they are and partnering with communities. And so I think the best way to, in terms of the headwinds, is to sort of reframe this. I think everyone's really focused right now on COVID, and rightfully so. But I think this report is meant to be not just about COVID, given we're in the pandemic, but more broadly about the merits of public health.
Got it. And now let's talk about the advantages of the moment for people coming together behind a vision of a stronger and more robust public health system for everyone in the United States. What do you think gives this moment a chance for change?
Well, I guess people say never waste a crisis. I always don't like that because it shouldn't take a crisis, right, to understand what we take for granted in this country. But as you know better than I do, Josh, we take public health for granted every single day. And so I think we need to make sure that we don't lose this moment where where we can help inform the public and policymakers about the role of public health in improving life expectancy and reducing morbidity and really tackling most of our health challenges, which if they're not challenged, then they show up on the healthcare side. And we know that there are a lot of disparities there and suboptimal outcomes because we don't invest in prevention and public health. And so I think that the tailwind here is that everybody's talking about public health. Public health is in the limelight. And this is an opportunity for the field and leaders to ensure that as people talk about public health, they understand truly what public health is all about, truly what it's trying to do, its role not just with respect to COVID, but its role with respect to trying to tackle all of the other challenges we have. So I do think that is an opportunity that we have, and I think timing-wise, why we didn't wait till after the pandemic. Right now, this is front of mind. This is front and center. And so I think from an impact perspective, we felt that this was the time really to launch the project.
In a sense, it's a bit of policy jujitsu in this, everybody's talking about public health. They may be angry about public health, but they're talking about it.
That's right.
And you're going to take that moment and tell them what public health really can do for them if there's a real investment and support.
That's exactly right.
Dr. Parekh, thank you so much for joining us on Public Health On Call.
Thank you, Dr. Sharfstein. Great to be with you.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.